Rifat Bibi is known case of valvular heart disease for 4 years. He was diagnosed by echocardiography. Now she presented to the emergency department with the history of weakness of left half of body for 3 days. At the time of weakness, she was sitting comfortably on her bed. She was brought to the emergency department 1 hour after the weakness, and after 1 hour, CT scan was done. Her weakness is complete, non-progressive, equal in arm and leg. Weakness is not aggravating or relieving. Patient also gave history of slurring of speech for the same duration associated with deviation of angle of mouth and followed by loss of consciousness for 2 hours with spontaneous recovery. She denies any fever, fits, urinary or fecal incontinence, difficulty in swallowing, reading, writing, vertigo or visual loss. She denies any rattling breath sound, bed sores or leg swelling. She gave off and on history of palpitation which relieved spontaneously. She was prescribed monthly IM injections but compliance was not good. She further denies joint pain, rashes, lumps and bumps, oral ulceration, hair loss, hand changing color and cold exposure, yellowness of eyes, abdominal heaviness, decrease or increase urine output, recurrent abortions, polyuria, polydipsia, and hot or cold intolerance. As far as past history is concerned, there is no such event in the past and no such disease running in family. Her past significant past history is negative for any surgery. Diabetes mellitus, hypertension, ischemic heart disease, tuberculosis, chronic hepatitis. She recently there was a angiography procedure was done by his left femoral. She is currently taking warfarin 5 mg daily for 4 years with a good compliance. No other history of addiction or Hakim medication. She have negative risk behavior for disease transmitted by blood transfusion, IV injection and sexual contact. She belongs to a humble background. Her husband is a laborer and hardly make boats and meat. They live in a 2.5 marla house which is properly ventilated and have adequate hygienic measures. They use tap water for household purpose and have proper restroom facility. And she also denies any contact with the animals and use of raw milk. During her stay in the hospital, CT scan, blood, complete blood examination, renal parameters, LFTs, lipid profile, thyroid function test, carotid Doppler, ECG, echocardiography was done and also blood culture is done.